thoughts on steroids. So in palliative care, we have a lot of different times we use steroids. So probably if you've been to the doctors for shortness of breath, like you have asthma or COPD, or you had a really bad pneumonia, or maybe you had a big swollen joint or gout or something similar to that, you've probably had steroids before. So there are some really important times to be aware of in palliative care that steroids can come in great handy. So a couple of those times that steroid use is actually an urgent need is when someone has brain swelling. So sometimes we have cancer patients who have brain lesions or a primary tumor in their brain, and it's actually causing pressure in the brain. And a lot of times that pressure is going to cause other symptoms, being neurologic symptoms like falls, confusion, word problems, eating problems, all kinds of things. So when someone presents with a tumor that is causing swelling, then we hit somebody with steroids. So the steroids will help shrink that tumor at least temporarily until we can get them to usually radiation. Now, another time that steroids are used is for something like spinal cord compression, bony tumors, especially in the spine, because same thing, tumors in the spinal cord can cause compression as well. So the swelling of a tumor in a teeny tiny spinal canal causes pressure on those nerves and actually can cause paralysis. So this is an emergency, and we put somebody on IV steroids immediately. Usually this is dexamethasone 4 milligrams 4 times a day, and then we'll kind of taper them from. So a couple of other times that steroids can be used, one is just for pain management. So steroids actually, like I said, they help swelling, and a lot of times with cancer-related pain, there is swelling involved, and therefore there is more pain. So if we can diminish the swelling around a tumor or diminish the swelling in a specific area, then sometimes we can at least temporarily help pain. Now there's a caveat to that, because with cancer, certain treatment modalities are actually affected by steroids, meaning they don't work as well. So typically if I'm thinking, oh, can I put this person on steroids for their pain crisis? I'm going to text their oncologist and say, hey, what are they on? Does it interact? Or am I okay to use this? There's definitely certain things that I know we should avoid steroids with, for example, immunotherapies, because immunotherapies kind of work with the immune system to fight the cancer. And if we give steroids, then we're kind of diminishing the immune response. So that's something that I typically know the oncologist is not going to love if I use steroids for this person. But we use them for other reasons like you would think normally. So if somebody has a swollen joint, if they have shortness of breath from a COPD or asthma exacerbation and they're kind of toward the end of life, we can absolutely try steroids. We're usually going to be in contact with their pulmonologist, their cardiologist, all of these other people to make sure that they agree that steroids are a good idea. Because the other thing is, if someone has like heart failure, steroids can make swelling worse and fluid retention worse. So we definitely still want to be mindful of those things. But in the cancer setting in particular, steroids come in big time handy sometimes. So let me know if this was helpful, if you guys have used them this way before. And as always, follow along for more.